This routine is to work through some tightness or stiffness you may be feeling in your hip and glute area, predominantly working on the gluteals themselves, and then we'll progress round into the front of the hip and more the hip flexor area. So for this particular exercise, you may want to use a band. It depends on your ability already. So you want to come laying onto your back first of all. Using any surface is fine, or using a mat or even a bed first thing in the morning. So lying with your knees bent first of all, nice flat posture, making sure that the back is flat to the floor here. You want to bring your right leg across to lay on the left leg, so your ankle area should rest just sort of above the knee on the left leg. And from this position you want to try and let the knee drop outwards, so you're almost creating a 90-degree angle here, and you want to either hold the back of the leg, or if you want, you can bring right through and hold onto the knee, or even behind the knee, wherever feels comfortable, and just maybe reposition the right leg a little if you need to. And then from here, you want to try and relax your shoulders back onto the floor. It should take a couple of deep breaths to get really comfortable in this position. Really try and feel those shoulders getting back towards the floor. Relax through the neck and the head. If you find that your shoulders are actually coming off of the floor and your head's off of the floor, you probably need to use the resistance band. So you want to wrap the band around the back of the leg. You can use a belt or a dressing gown loop, whichever works for you. So using your arm strength, you're going to bring the legs towards you. This allows the shoulders to stay on the floor and the head is relaxed, and you're not feeling any pressure coming through the spine. So you just need to bring the strength to there. And then what you might find is that you can start to assist with one hand, and then eventually get to two hands and not need to use the band. And you want to hold this stretch for at least 20 to 30 seconds. And once you've done so, you may just want to start rocking ever so gently from left to right. Just starting to feel how changing the angle changes where you feel the stretch. It's always nice just to start mobilising through here. Maybe just do this for about 10 seconds. And then we're going to switch sides. Now, often we have one side that is tighter than the other. If you do experience that yourself, you may want to find a little bit more time, take a little bit longer to actually stretch the side that does feel a bit stiffer and tighter. As long as it's not painful, nothing's going numb, there's no tingling, numbness in the feet, and there's no pain in the back. So we're going to loop back through here and try and relax the shoulders and the head. My left side is a little tighter, so just always takes me a few more seconds to relax into this pose. You can always try an alternative of just behind the leg here, or again you can use the band in this position just to bring the legs into you so that your shoulders never leave the floor. And once this pose starts to get a little easier, again you just want to rock from left to right. You're only really moving a couple of inches, this isn't very big movement at all. and then relax out of this pose. So this is a standing stretch to work on the glutes, the hip area. Also involves a little bit of core training because you're having to balance. So you want to stand on one leg, so we're going to stand on the left leg first, and you're going to cross the right leg over so that it sits just above the kneecap. And then from this position, either hands out to balance, or you can have them on your hips, wherever works for you. You're going to sit down, imagining you're sitting into a chair, keeping the chest forward, head nice and tall, back nice and straight. And you're just going to take 20 to 30 seconds, maybe a little longer if you need, just to really sit back into that stretch. Trying to keep this foot that's on the floor nice and still if you can. Maybe push the knee out a little if it feels that helps stretch deeper into the right side. And then come back out. So onto the other side, we're going to take the left leg now over to the right side. And going to sit back down, really trying to sink into it, reposition the leg if you need to, push the knee out a little if you need to. And you should really feel a deep stretch around the side of the glute here into the bottom area. Keeping the back nice and tall, chest forward, head nice and tall. Don't want to be gazing up or anything, just the head in front of you is fine. And just keep sinking into that right leg, sinking your weight backwards for around 20 to 30 seconds. And come back out. So to start working the front of the hips, I always think it's a good idea to work on stretching the quads first. Many of us get problems with the hip flexors because of tight quads. We also sit all day, so we're in a shortened position, and often when I do get people to advance onto doing a hip flexor stretch, they tend to feel it in the quad first. So it makes sense to stretch the quad and then go on to the hip flexor. So the easiest way of doing this is actually in a standing position, and what you want to do is you're always going to have your knees level, legs together. So first of all, you want to bend the right leg, and you're just going to grasp the outside of that foot. And then once you feel grounded, your balance is good, focus on something ahead of you. This is where the fine tuning is. So you need to make sure that your hips remain level. So it often means dropping that right hip down a little so that you're level. Your right and left knee need to be touching, and then you want to push forward from the hips. Now once you feel stable in that position, you're going to try and pull your ankle towards your bottom. Now your hips need to be square facing forward, knees need to be touching, and hips pushing forward. Nice, tall, strong posture. And you're going to hold this for maybe 20 or 30 seconds. Really pushing forwards from here, bringing the knees together, bracing the chest forward, shoulders back. And I'll just show you from a front angle. So on the other side, we're going to grab the outside of the ankle, bring the knees together. You're going to drop that hip down slightly so that the hips then become level again. And you're going to push forward from the hips, chest forward, head nice and tall, knees together. Really ground yourself here. And then you're going to try and pull that heel back towards your bottom. Again, maybe 20 to 30 seconds. If you need your arm out for balance, you can. Really trying to keep everything in line. Hips pushing forwards at all times. So this is a lovely stretch that targets the hip flexors, the muscles around the front of the hip here. You may want to use a small cushion or a rolled up towel. I've just folded my yoga mat in half just to have a little bit more cushioning, as you are going to be kneeling. If you have pain with kneeling, this particular stretch might not be suitable for you. So you want to come into a kneeling position with both legs at a 90-degree angle. And you want to have the back foot relaxed, but your weight needs to be fairly even between both sides. Now, the most important thing to do, first of all, is to do a pelvic tilt. So you're going to want to tilt your pelvis backwards, flattening the lower back here. A very subtle movement. Most people struggle in this position. And once you feel that you've been able to do a bit of a pelvic tilt, you want to try and then lean forward. You should really only be able to stretch maybe a few inches. Certainly if you've never done this pose before, you shouldn't be able to move very far, because if we don't tilt the pelvis, you don't really target the right area. Might be a good movement exercise, mobility for the hip, but you're not really getting a static stretch for this area. So you really want to get a pelvic tilt first, nice tall posture, and then you're going to lean just a few inches forward. And you want to hold this for a good 10 to 15 seconds. Trying to lean a little bit further forward as time goes on. And then just come back out of the pose and relax. And then you can repeat that maybe 2 or 3 times. So I'll just switch sides. So again, you may find one side is tighter than the other, one side's easier than the other. You may want to focus a little bit more time on the side that you struggle with. So again, you want to tuck your bottom under, so tucking the pelvis, bringing the pelvis backwards, leaning forward, just a couple of inches. It is quite a subtle movement. Really starting to feel around the front of the hip there. And again, 10 to 15 seconds, repeated 2 or 3 times on each side. Now, if that didn't feel like a particularly deep stretch for you, or you've done this stretch before and you feel like you need something added into it, you come into the same position as before, you tilt the pelvis backwards again and you lean forward. Now, once you've got into this forward position, you feel you're at your maximum stretch. You can feel maybe the top of the hip around the quad area. The same side that you're stretching, bring the arm up in front of you to above your head, and then you're going to slightly side bend and lean backwards. Now, it's up to you to play around with that angle, as everyone feels stretches in different ways. But as long as it's a slight C shape through the body and a little bit leaning backwards, still maintaining that pelvic tilt, that should start to really increase the stretch. You may feel a little bit in the lats here, that's fine. And then again, come back out of the pose. We're going to switch sides. So the tilt is the most important part. Lean forward, allow that just to relax, get to your maximum stretch. Feel comfortable, you can still breathe and talk. You're not having to hold your breath or shaking. Those are often signs that you're stretching too deeply, too quickly. You bring the arm up in front of you to get to beside your head. You side bend and then you lean backwards. And again, you want to play around with that angle until you can really start to feel it higher up this time. A little bit in the side of the body is fine. And again, you're going to hold this for maybe 10 to 15 seconds, maybe a little longer.